So we are going to talk today about vulvar cancers. But what is interesting in all these years when I have dealt with vulvar disease is that women themselves don't know what is the vulva. They think that everything is vagina. And all of you all who've lived in Bombay and India have heard about the play which is called Vaginal Monologues. And Vaginal Monologues, quite a lot of people, at least in Mumbai, have seen it. But if I ask the people about vulva, they immediately say, we don't know what the vulva is. So today it's very important that you'll know a little bit more about the parts of your female genitals. So what is the vulva? So if we look at the vulva, if you look at this body, you'll see this part is the vulva. And this is the external part which is visible to us. This vulva, which is here, which is what we see here, the external part, is actually the gateway to the entry into a canal which is called the vagina. And at the top of the canal, we have the uterus mouth opening to it. And that part is the cervix. Then you have the uterus, then you have your tubes, and then you have the ovaries. So I find that people call this external area vagina. There's a total difference between the vulva and the vagina. You can have cancers of the cervix, you can have cancers in the vagina, but you also have different cancers in the vulva, which we are going to discuss today. So if you look at a vulva, you need to see that a normal vulva has specific parts which are there. And all women should normally have these parts. So you have the outer thick lips, which is called the labia majora. If you separate them, then you have these inner thin lips called the labia minora. And these labia minora join at the top to the clitoris, which is protected by a little hood called the clitoral hood. The vulva, as I told you, is the entry to the vagina. So it has an opening you can see here, which is the entry to the vagina. In virgins and children, there's a little membrane here, which is called the hymen, which after intercourse can rupture. Also in the entry point, you have the opening of your urinary system, which is the urethral opening. So your urine will come out from here, flow, and then come out. Many times, problems in the vulva can actually obstruct this urethral opening. Like cancers, if you have big growths, they can actually obstruct this urethral opening, and the woman will have difficulty in passing urine. At the top of the vulva, we have a lot of hair, and surrounding the vulva, we have a lot of hair. This is called the pubic hair. The reason why the vulva has so much hair is during evolution. The second thing is that the hair actually buffers the injury to the vulva. Also, the hair is associated with various glands which give you the particular odor, which is also a sexual attractant. So this is what you need to know about your vulva. And I would encourage everyone to look at it and see all the parts of the vulva. So just as your other parts of the body have hair and skin and mucous membrane, the vulva is covered with skin and hair like the other parts of the body. And just as you can have diseases on other parts of the vulva, other parts of the body, for instance, on the skin, you can get fungal infections, you can get psoriasis, you can get lichen planus, you can get eczemas, you can get leukoderma. The same way, because the vulva consists of skin, the glands, and the mucosa, the same diseases can manifest on the vulva too. Of all the diseases which can come on the vulva, there are a few diseases which can predispose to vulvar cancers, and I will be discussing them a little later. So you must remember that our body in good health is silent. For instance, we don't know that we have a nose, we have toes, fingers, because there is no pain, there is no discomfort. Once a part of the body has any problem, any complaint, we immediately get some pain, we get burning, we get various symptoms which suddenly make us realize, oh my God, my toe is hurting, my nose is hurting. So same way, the vulva in normal health is absolutely silent. So if you have heard on the net or if you have heard from other doctors that, oh, if you have itching on the vulva, if you have, it's very normal for a woman. It is not normal. The vulva in good health, like other parts of the body, is silent. So, what are the problems that you can get on the vulva? You can get itching, you can get burning sensation. If you look at it, there can be a change in color from pink, you can get dark patches, or you can get white patches like a leukoderma. Some people come with severe pain. Some say we've got a very foul smelling coming out of our vulva, vagina. Some have boils which are painful, or some have little things like acne. Some people come with ulcers, they come with bleeding, sudden bleeding, or they say that we have some growth on the vulva which we don't know. So these are the things which can happen on the vulva, which immediately should alert you to come for checkups. So why do we need to treat vulvar problems properly? Because certain vulvar skin problems, when neglected or untreated, can lead to skin cancers. And skin cancers are not a light problem. They are very serious because they can cause a lot of disability to the woman. Certain infections too can lead to pre-cancer conditions, which I will very lightly discuss just now. So how is vulvar cancer very common? So again, I repeat that when I'm talking about vulvar cancer, I'm talking about cancers which happen on the external visible part of our vulva or just when you open in the inner lips. I am not talking of cancers which are inside, which is the vagina and which is the uterus. I'm talking about the external part, which is skin, glands, mucous membrane. So although vulvar cancers are not very common, about 1.3 to 5% of any cancer in a woman are vulvar cancers. Now you all may say that this is a very small statistics, but if you get it, you're not a statistic, you're 100%. So hence, any incidence of any cancer is not acceptable in our body. The total vulvar cancers up to 2000 usually, the vulvar cancers come in patients who are above the age of 50. So 80% of women above the age of 50 can have vulvar cancers, and above the age of 60 and 70, about 50%, the incidence is in 50% of the women. What about infections? There are certain infections which happen on the vulva which can predispose to cancers. These infections are usually sexually transmitted. The commonest infection which is cancer producing or oncogenic is by the Hpv virus. I think a lot of you all are aware of the Hpv virus, which is known as the human papilloma virus. There are about 100 viral types of this HPV, and a lot of us have suffered from warts on the fingers, warts on the face, but these are not the HPV types which we are talking about. The types which are due to type 16, 18, 31, 33, etc. are the ones which are important in causing cervical cancer. The ones which cause common warts are not something we worry about in terms of causing cancer. HPV is sexually transmitted, and the more sexual partners you have with unprotected sex, and the earlier age of onset for sexual activity, the higher chances that you are going to get some sexually transmitted disease. And the commonest we are seeing is by HPV or herpes. You must have heard of herpes simplex. This is caused by a virus which is sexually transmitted. And the problem with these viral sexually transmitted diseases are that once they come into you, they tend to linger on for years and years. So, for instance, if anyone has had herpes, you will realize that once the herpes heals, you can have it again over the years. You can have it once a year, you can have it 8 times a year. So the virus remains in the system. The same way the HPV virus, once it enters into you, and you will never know whether your partner has the HPV virus because the HPV virus is so small that you need an electron microscope to recognize it. So in the early stages, it may just exist on the skin and transfer by sexual contact. As it multiplies in the skin, it causes changes in the architecture of the skin, and it may start as little black dots. Then it may grow and form little cauliflower-like growths. And we have had patients who their whole vulva, you cannot see, is just filled with this sort of cauliflower blackish growths. And these are very contagious. So even if you rub it a little and you have these little pieces coming out, they all are carrying millions of viruses. And if there's any entry point, like even a hair follicle, which is a little injured, they can enter through the hair follicle and stay there for months to years before they grow. We are seeing a lot of HPV infections now outside of the vulva. Besides sexual transmission, we are also seeing it because of the beauty treatments which people are doing. So people are going to parlors and doing waxing and lasers, and we are seeing a lot of infections coming from those areas. Once you do waxing or laser, the hair follicles are open for some time. So if the instrument is already carrying a virus, it can enter through the hair follicle. What are the skin diseases which can predispose to a vulvar cancers? Any skin disease which lasts for months and months and months. These are chronic conditions which are often they have a common symptom which is itching, severe itching, which goes on for months and months. And when we examine the patients, there are 3 things which are common, which we see as a part of chronic itching. And these are very easily recognized by dermatologists because we see skin diseases across the body. One is a chronic eczema on the vulva. So if you have eczema on the rest of the body and you have chronic itching on the vulva, it can be due to a condition called a Lycan Simplex chronicus or a chronic eczema. You can have a chronic eczema on the vulva by various things. One is just the contact of a wet underwear to your skin can cause the skin to get vulnerable and cause irritation. The second thing is that sanitary napkins which we wear. There are very advanced sanitary napkins which are called Ever Dry, Extra Dry, and they have a special liner which prevents the moisture remaining on the surface. And these liners are synthetic and can cause a contact dermatitis. Also, people have become so obsessive with cleaning their vulva. So they use strong detergents, strong irritants. I know patients who use Dettol and Listerine to wash their vulvas. They use strong, even the washing soaps to wash their vulva in the hope to cleanse it. And that can cause a chronic irritation and can predispose to chronic eczemas. The second very important disease, which I think a lot of women don't know, but they should be aware about, is a condition called lichen sclerosis. Lichen sclerosis is a condition which affects women. It is an autoimmune condition. It is autoimmune like other autoimmune diseases which you can get, which are thyroid disease, diabetes, pernicious anemia. And we find that patients with lichen sclerosis, if we test them for thyroid disease, about 30% of them are positive. So what happens is, in a body, multiple autoimmune diseases can coexist. Lichen sclerosis patients can be children or they can be adults. Children who are prepubertal, they can have itching. So your child, if you see your child itching from the age of 5, 6 onwards, don't take it carelessly, because lichen sclerosis can start in childhood. In children, the common complaints is itching, constipation. You may see little scratches on the vulva, or you may see little bleeding on the underpants of the child. The child may have difficulty in passing urine, may cry because of the burning secretion. In adults, the common complaint is itching, intractable itching. Patients do a little treatment, they are better. They are always diagnosed as fungal infections. This is not a fungal infection, this is a skin disease. And in this, what happens is that it is a very destructive disease. So slowly, what it does with the inflammation, it scars all the vulvar parts. This is the reason why I showed you the first two slides, which showed you what is normal in a vulva. In a condition of lichen sclerosis, the patient will not have any labia minora, the patient will not have any clitoris or clitoral hood, and in the later stages, the whole vulva will be nothing but a white patch. Initially, it is mistaken as a leukoderma or a vitiligo. But if as dermatologists, when we examine the patients, first thing we see is the missing parts. We call it the missing vulvar part disease. So we see missing parts, we see scratch marks, we may see little punctate bleeding, we see the blood vessels which are opened up, and we see severe scarring. As it progresses, the scarring is so severe that it can obstruct the urinary passage and the patient will have difficulty in passing urine. This lichen sclerosis can also affect the perianal area. So we call it a figure of 8. So if we are examining the woman, it's not only white in front, but also white around the anus. So this is called a figure of 8. And such patients complain of severe anal itching and also can complain of constipation. This disease, if it is neglected and it goes on, about 3 to 8% of the women can develop vulvar cancers. Hence, it is very important that lichen sclerosis, because it is a very treatable disease, it is recognized early and managed. There was a lovely study which was done in Australia where they divided the women into two groups. In one group, they had lichen sclerosis and they gave them treatment, and the women were totally compliant. And the other group, patients were not compliant. And they followed them up for 10 years. And 10 years later, they found that the women of lichen sclerosis who took their treatment properly, were compliant, they came for follow-ups, they had 0 incidence of vulvar cancers. The non-compliant patients had the incidence of cancers like it's reported in the literature. So this just justifies why it is so important to recognize and diagnose the disease. The other condition, which again I want to talk about, is lichen plainness. Lichen plainness, some of you all must have heard. It comes in the mouth, it gives you little whitish patches and usually recognized by the dental surgeons. Patients complain of difficulty in handling handling spices, handling sharp things. They're always feeling sore in the mouth. Lichen planus can not only affect the mouth, but it can affect the vulvar mucosa, the mucous surface. And there they complain of severe pain, itching, burning, and difficulty in sexual intercourse. Both patients with lichen sclerosus and lichen planus, their first complaint also can be, I have pain during intercourse. It was not a problem earlier, but now I'm developing pain. So these are again the clues that you need to come for examination. In lichen planus, it is more destructive than lichen sclerosus. With lichen planus, it eats up all the parts of the vulva and it scars. So finally, the vulva is just a little hole. We can't see anything else in the vulva. So again, this is a very aggressive, destructive condition, which is not uncommon. We have cases of lichen planus and lichen sclerosus. Lichen sclerosus more than lichen planus in the vulva. So both, if neglected or untreated, can lead to the development of vulvar cancers. I have not put up any images of vulvar cancers because it would be very shocking for you all. But I will tell you how the vulvar cancers can look. So I've talked about this, the symptoms of lichen sclerosis are itching, burning, painful intercourse, constipation, bleeding, white patches, missing parts, and they can ultimately develop a cancer. When do we suspect a cancer? Like, all of you women must be listening to this and saying that, oh, I've had so much itching and I've been treated by my gynecologist and I'm fine. Absolutely. So if you have a itch which has been treated for many, many months and it is not eradicated or you're not getting any relief, that is the first thing you must come maybe to a dermatologist to also check. Second is if you had a little ulcer. Ulcer means an abrasion or a deeper abrasion in your vulvar area and it has not been healing for years or months or weeks, you have to come and check. Third is if you have something, if you feel your vulva and if you feel an area which is a little rough or which is a little raised and rough or like a little growth, that's the time you have to come in and have a checkup. Or if you sort of feel your vulva and you feel a certain area, it doesn't feel soft and smooth like a normal vulva feels. It feels hard, and when you touch it, it's a little painful, or you get a little burning sensation. That's the time you come and check whether this needs a further investigation like a biopsy. I talked about lichen plainness. On the skin, it comes as small pinkish to bluish little bumps, but on the vulva, it will be darker in our Indian skins. The entry to the vagina, remember I showed you the vulva and then the entry? So that entry will be very red and sore, or there may be severe scarring. When it affects the mouth, you may get bleeding from the gums, and we've had cases where the inflammation in the gums is so much with the lichen plainness that slowly their teeth start falling off. And I have patients who at the age of 50 are edentulous, that means they have no teeth, because their lichen plainness was not recognized for so many years, and it slowly caused destruction of the gums, so there's no support. The good thing is all these conditions are treatable to prevent cancers if they are caught early. How can we, so we all have daughters, we have cousins, we have nieces, we have sisters. So how can we prevent, how can we educate them to prevent vulvar cancers? One is that talk about sexual education to your children and talk to them about the importance of starting sexual activity at a later stage. This is very important. When I say later stage, I don't mean start at 40 and 50. What I mean is don't start, because nowadays we have a lot of sexual promiscuity, which we have girls coming to us at the age of 14 and 15 and 18 and 20, and we ask them, how many sexual partners do you have? They said, no, this is the third or this is the fourth. Or even if they have had one sexual partner at the age of 15, they always tend to reassure us that no, he is very clean, he's my boyfriend. And if they've had two, so we just gently tell them that if he's your partner at this stage, how do you know how many women he has had sexual activity with? So just educate your children about starting sexual activity at a later age. We as older people will always counsel that a single partner is the best. And medically, it is still proven that those who have a monogamous relationship have lesser chances to predisposing themselves to vulvar cancers. Smoking. Smoking is very important for all the cancers, but especially for vulvar cancers, smoking has a direct relationship. It affects the DNA of the cells and it makes the skin less protective to prevent the formation of cancer. So smoking is a total no-no in life, especially for vulvar cancers. Educating your girls, educating the women to examine themselves, to come for treatment as fast as possible. In India, women are the last priority. I know from experience of dealing with women in the vulva clinic and in my practice. They will come last, they will delay the checkups, and they will not even come for follow-up. So a lot of time we have to chase the women. Please do your pap smears that the gynecologists in their lectures will emphasize the importance. Why we have started this vulva clinic in Hinduja is because the women's genitals starts from the outside and it goes inside. So problems in outside, which we can diagnose, can, if undetected, can go inside the vagina. Problems in the cervix, infections can come outside and affect the vulva. Hence, the importance of our vulva clinic, so that if need be, the gynecologist comes in to check, the dermatologist comes in to check, and you get a comprehensive checkup of your genital disease. Do not delay checkups. That is very important. Now, the most important is HPV vaccine. HPV, as I spoke before, is the human papilloma virus, which is a wart virus. There are 100 types. It can cause normal warts on your fingers, on your face. We are seeing so much on the face also. But it's commonly a disease of children. We rarely used to see it in adults, but now we see it again because of the contact from other people, our beauty procedures, threading, waxing, lasers. We are seeing it all over the face. We are seeing it on the genitals after lasers and waxing of the pubic area. So HPV type, which is 16, 18, 31, 52, these are the oncogenic type. We have vaccines for HPV since a lot of years. But now the HPV, the Gardasil vaccine, which has against four viral types. We don't have the more advanced vaccine, which has protection against the more numbers of the viral types. But in the Gardasil, we have protection against 16 and 18, which is the oncogenic virus, which is the cancer-causing virus. So we encourage, and it is recommended, that girls about the age of 9 up to the age of 26 before sexual activity need to take the HPV vaccine. It is taken as 2 to 3 doses. One dose, you repeat the second dose in 2 months and the third dose in 6 months. It is given on the deltoid, on the arm. Certain countries have seen that with the HPV vaccine, they have reduced the incidence of vulvar warts to 0, as well as to cervical cancer. They have drastically reduced because a lot of cervical cancer is HPV induced. There are a lot of different cancers we see on the vulva, as I mentioned before. So one is a verrucous type of cancer. It looks like a growth. So that's like a squamous uh, cancer. It is hard. You may have a little mole on the vulva, which may increase, and that can give you a melanoma. You can have basal cell carcinomas on your vulva. So there are so many cancers which you can get on the vulva. Dealing with cancers is a holistic between, so recognition is dermatologist, for the vulvar cancers, gynecologist. The management is by the gyneco-oncosurgeons, by oncosurgeons. So it's like a multi-speciality disease we are dealing with when we are dealing with women with vulvar cancers. So HPV vaccines were successful in preventing cervical and vulvar cancers. And as I mentioned, so if you have daughters, if you have nieces, please encourage them to take this HPV vaccine. Now, it is also recommended for males because males also have these genital warts and males can also transmit. Also, please encourage your younger people that if they are sexually active to please use protection. It is very important. However well you know your partner, until you get married and have children, please try and protect yourself from sexually transmitted diseases. So this HPV vaccine is also now recommended for young boys and men. So examine yourself. We encourage you, examine yourself with a hand mirror. Look at your vulva. See that all the parts are there. Please do not go onto these sites which show you these so-called aesthetic vulvas with perfection. Vulvas are not perfect, okay? Vulvas are different in different women. They have a huge wall, a vulvar wall in Scandinavia, which shows the difference to show to women that you cannot have a perfect vulva. So just look at yourself that the parts are all right, you don't have white patches, you don't have any moles on the vulva. You don't have to have an aesthetic vulva, which is now being encouraged. Examine it monthly so you can see any change. Don't be obsessive about it. Just examine it how you examine your skin and your body parts. Now, I'm open for questions. I hope this little introduction gave you some insight on how to deal with how to prevent and how to recognize vulvar cancers. I also want to mention that you have overt vulvar cancers and you have the vulva intraepithelial neoplasias. These are what are just in the skin. They have not still developed into full-fledged cancers, and those are the entities which require early intervention and recognition. There are two types of vulva intraepithelial neoplasia. One is called the usual type, which is caused mostly by the Hpv virus. It is seen in younger women. The second type is called the differentiated vulvar intraepithelial neoplasia, and that is seen in older women, above 50, 60. It is a more aggressive type of cancer, and it is always starts with a skin disease like a lichen sclerosis or a lichen plainness or a very, very chronic inflammation. So that is a differentiated type. In the vulvar intraepithelial neoplasia, which is the usual type, if it is not the oncogenic virus, a lot of them self-resolve. But if it is a oncogenic, it can progress to the high-grade squamous intraepithelial lesions. So hence, it is very important to recognize these vulvar cancers. Thank you very much for all who have tuned in and who have been listening. I'm open for questions now.
Yeah, thank you, doctor, for such an informational talk. We have couple of questions. So the first question is, I get feeling of itching at regular intervals. When this happens, it is very worryful when the itching feeling comes again. Is it safe to use V wash and the like regularly?
And
And the same product like V wash.
ah,
Is it safe?
right. So when we are talking about genital hygiene, the thing is that as a rule, even water is sufficient to clean your vulva. You don't have to use very special washes or detergent soaps or Dettol soaps or Lifebuoy soaps. That's rule number one. Rule number two is you don't have to push the wash inside your vagina because you're going to push in infections. The vagina and they are all self-cleansing. They cleanse themselves. You don't have to clean inside your vagina. The washes, which are V wash and the other like washes, they are safe. They were developed because for women who had a lot of vaginal discharge, the women who had infections which caused a lot of smell. So these washes were developed for such sort of women. But as a general rule, water alone is sufficient to wash the vulva. Having said that, washing 100 times with water every time you go and pee, that is okay. But the more important thing is dry yourself. If you leave your vulva wet, skin gets very soft and macerated, it gets whitish. Do you know that when you put your hands in water for a long time, have you seen how it becomes white and wrinkled? Or if you're swimming for a long time and if you look at your hands, they get all wrinkly. That is called maceration, where a lot of water has gone into your outer layers and now made it very soft and easily damageable. So same way with the vulva, because it is in an area which is occluded, which is prone to pressure and friction. If you leave that area wet, it is prone to getting more infections, more eczemas, more skin problems. So in vulvar hygiene, the emphasis is on keeping the area dry. So if you have a habit of washing it, dab it dry. Your underpants should not be wet because that wet panty in contact is going to constantly irritate. Also, there are people who pee but they don't wipe themselves. So if you have urine coming on your panty, that also can irritate. Then there are older women who have a little incontinence. They have bladder incontinence. So when they cough, a little urine flows through. So that urine on the underpants in constant contact can cause a constant irritation. So answering your question, yes, these are safe to use. But as a general rule, vulva hygiene you can just do with water and keeping the area dry.
All right. With respect to my earlier question of itching happening at regular intervals, I feel dryness during intercourse a bit painful. I
Oh,
wash the area with my bath soap.
I
How
need
often should I do pap smear? I do regularly every year, but in 2020 I avoided due to the pandemic.
I need to know how old the person is. That is
Okay.
important
Whoever has asked this question, please let us know what is your age.
because then the answers will be relevant. Otherwise, they will not be relevant to the question. But having said that, I get itching on a regular basis. You should not be getting itching on a regular basis because itch always has a cause. So we have to see that you have an infection. Have you been treated? I'm sure you had a lot of treatment for the infection. We have to see whether you have a local skin disease. We have to see whether you're developing an allergy to your pads, your sanitary towels. So there are so many things we need to see when we look at your vulva and to diagnose what is the cause of your itching. And I will keep repeating that vulva itch is not a normal phenomena. There is always a cause for vulva itch which has to be diagnosed.
Doctor, she is 54.
Okay, so can you repeat her questions?
Sure, I will. With respect to my earlier question of itching, I
Yeah,
feel dryness during intercourse a bit painful.
right. So
Could you suggest some good liquid to use to clean the area? And even she have done a pap smear, but in 2020 she did not do it because of the pandemic.
right, right. So I think your each question we have answered. Second thing is because now you're in the menopausal age, if you have constant itching, we have to check you for skin diseases. That is a second thing. During menopause, what happens is the estrogen goes down because the estrogen goes down, the whole structure of the skin changes. The skin and the mucosa inside does not have the ability to produce its moisturizer. Also, the mucus glands do not produce as much of the lubricant secretion as they would in a premenopausal person. So, intercourse, which is dry and painful, is a very common complaint of menopausal women. If you have this problem, you need to use a lubricant. There are a lot of lubricants available in the market, which are vulva lubricants, vulva vagina lubricants. So, what you can do is apply a little at the opening of the vulva. You can do it on a daily basis if you have more frequent intercourse, or you can do it just before the intercourse. That is the first thing. The second thing is that we live in an urban environment, but I have dealt with patients in the rural environment who also had this vulvar dryness, and what their solution was, they use butter, they use homemade ghee, they use coconut oil, all these things to lubricate the vulva and the vagina. There are also lubricants which contain hyaluronic acid, which are also lubricants which can be used for the vulvar area and for reducing this pain during intercourse. I think pap smear, the gynec would be the best person to talk about the pap smear. And definitely the COVID time and the lockdown has given us a lot of problems because patients could not come for checkups. And I have had cases of lichen sclerosis who could not come for a checkup. And in one of them, we have recognized a cancer which has formed. So this lockdown has been something which has been a disaster for health. But I think your gynec will be the best person to advise you how often you need to do a pap smear.
Okay, doctor, the next question is I have two daughters who are 26 and 24. Can they take the vaccine?
Of course.
Yeah, difference between cervical vaccine and HPV vaccine.
So the HPV vaccine has protection against more viral types. So that's why we encourage now the HPV vaccine. So we have the Gardasil which has 4. We don't have the more advanced which is available in the Western countries, which has more viral type protection. But definitely they should be taking the HPV Gardasil vaccine.
Okay, the next question is what does it mean to have the white deposit in the folds of outer lips?
Very nice question and very relevant for everybody. So, what happens is we have a lot of glands on our vulva. We have sebaceous glands, we have apocrine glands. So, if you look at your nose, I'll just give you an example. If you squeeze your nose, you get this little whitish thing which people keep telling me, oh, we have so many white heads and we keep squeezing out. That is a secretion from the sebaceous glands. It's a secretion which keeps the skin greasy. Same way, the vulva also has these glands, and in some people, the glands are a little more active, and that secretion which comes out is what we have, which is deposited as a whitish deposit. If the deposit is there and you don't have any itch or the area is not red or sore, nothing to worry, it's your normal secretions. You can leave them or you can just clean them with a little water and a little tissue, nothing to worry about. In men, they have similar secretions which we call smegma. So, smegma in men, we also have it in women. And just extrapolating to make you understand better, it's the nose which, when you squeeze, you have your sebaceous secretion. I hope
Okay,
that answered your question.
yeah. The next question is if someone has had vulva herpes, any danger for cancer?
Vulvar herpes and cancer, there's not been a documented relationship. So I don't think for vulvar herpes you have to worry. But if you have HIV, and you have a herpes which is not healing for months and months and months and months, because that can happen with HIV, then we are always looking for any alteration in the anatomy, because as I mentioned before, any chronic condition which lasts for months and months can predispose to a change in the cells to encourage cancer change. And as I told you, HPV is such a silent thing. We don't know that we have HPV, but now in your pap smears, HPV is also tested. So that's a great thing which has started. So when they're doing your pap smears, they're also testing for HPV. So that's really nice.
Okay, the next question is itching on the outer lips from a longer duration. Started with antifungal treatment with lotion and even tablets from last 10 days but did not show any results. Hygiene is also taken care. What more can be done?
So I want to ask the person that, did you go to a gynecologist or did you go to a dermatologist?
All right. Please comment down.
And then come
So,
back to that question.
sure, we'll take the next question till the time. Is it safe to use menstrual cup during, having your periods?
Menstrual cups have become a little more in use now. Menstrual cups have been proven to be safe provided that you are using them properly and you are cleaning them as the recommendations. So, menstrual cups are safe. I will just extrapolate this question to tampons. A lot of patients ask us if tampons are safe. Previously, in the, I think it was in the 70s or 80s, there was a big toxic shock syndrome which was caused because of tampons being left inside for a long time. So the important thing is that whenever you're using these hygiene products, there are certain baseline rules which have to be followed when you're using them. So, it's, for instance, when you ask me about menstrual cups, there are protocols of how to clean them, how often to remove them, empty them. Same way, when you're using tampons, you have to wash your hands before you insert the tampon. You have to keep it for X amount of time. You have to remove it. You have to not leave it for more than uh, many hours, because that's the time you can have infections. You should not use tampons when you have infections outside or you have an infective vaginal discharge. So there are so many protocols to be followed. So to answer your question, vulva cups, menstrual cups are safe provided you follow the protocols.
Next question is I'm suffering from LP of vulva. How safe is laser removal of hair around vulva? Are hair removal creams safe? I'm allergic to hair removal cream. What are the safe alternatives methods of hair removal?
So this is a very interesting question, because in in your older people, except for certain cultural communities, hair removal on the vulva area was not a norm, right? Who used to wax or clean or thing? It was only a cultural and certain communities and religions that you had to uh, keep that area hair free. As I mentioned before, the hair is there for a protective mechanism. It's like a cushion. It protects the vulva from injury. So it also produces the odors which are sexually attractive. But now, with all the media and the hype and everything, hair reduction on that area has become a big business and a big thing where everybody has to do it. In fact, a hairless vulva is a child's vulva. If you see a child's vulva, it is a hairless vulva. And there are actually now psychologists talking about people wanting hairless vulvas, the men wanting hairless vulvas. Are they pedophiles? Why do they want a hairless vulva? Because a hairless vulva is not a normal thing. But having said that, if you want to do hair removal, if you have lichen plainness, you should not be doing any of these hair removal procedures, because lichen plainness is a disease which has a possibility of what we call a phenomenon called Keebnerization. That means if there's any injury to the skin, you can get lichen planus in that area. So, in a person of lichen planus, I would definitely not recommend lasers. I would not recommend hair removal creams because you are allergic to it. You yourself are saying you're allergic. So, again, the phenomena of keepnerization, if you're going to irritate the skin with anything, you're going to get allergies, you're going to increase your lichen planus. The only thing, if you want to do anything, is trim the hair or maybe shave the hair very gently. But lasers, waxing is totally out for you. Anyone with any skin disease on that area.
Okay, doctor, back to that question where you have asked if whether she have, consulted a gynecologist or not. Yes, she have consulted, and even they have, she have got the
Sorry
that
for interrupting. Sorry for
yeah.
interrupting. My question was, for your itching, did you consult a gynecologist or a dermatologist?
She have consulted gynecologist.
Okay. So now I will answer her question.
Okay.
Again, as I introduced before, the vulva is covered with skin, hair, glands, which is like skin all over the body. Skin diseases which happen all over the body can happen in the vulva. A dermatologist is required to diagnose what is your problem. When you have an itch on the vulva, as a dermatologist, for me, a fungal infection is my last diagnosis because the women who come to me have been had innumerable causes of fungus, antifungals. Fungal infections are not the only things which cause vulvar itch. Remember, they are skin diseases. What you need to do is you need to see a dermatologist who will examine you and see, do you have eczema, do you have contact dermatitis, do you have seborrheic dermatitis, you have another sort of thing like a Paget's above, and there's so many things. So you need to contact a dermatologist for giving you a relief in your problem.
Okay, the next question is I had ovarian cancer before 3 years and relapse of liver cancer in 2019.
Right.
Is there any chances of getting vulva cancer?
Oh, such a great question. I'm not sure if I have a perfect answer. But when you have multifocal cancers, like you have liver cancer and you have ovarian cancer, you just have to be alert. You have to keep your antenna open. But I cannot give you an answer whether you'll be more prone to vulvar cancers. But you just have to be more alert. So even for you, examining that area doesn't cost much. It doesn't take time. So just be alert for any symptoms which are unusual, only because you have multifocal cancers.
Okay. Is waxing of vulva hair advisable?
Waxing of vulvar hair, uh, okay, again, I said that it's not necessary to remove your hair, first thing. Second thing is that if you have bad acne on your face, on your back, on your chest, it's avoidable to wax on the vulvar area because you can get the same sort of folliculitis inflammation on your vulva. There are certain people who have diseases like hidradenitis suppurativa, where they have these swellings in their underarms, in their groins, who are obese, who constantly suffer from boils all over the body. For them, I would definitely not encourage waxing. But for people who tolerate the waxing and who have not had any problem, I mean, there's no contraindication.
Okay. The next question is during menstruation, how often do one change the sanitary pads? And what type of sanitary is more safer compared to the dry surface gel types?
So everyone doesn't react to sanitary napkins. Okay, I'm talking about a certain group who are genetically inherently allergic and hyperreactive. So for the general public, the convenience of these ever dry, these larger ones with the wings is very convenient. And if you've never had a problem, please continue. But for the group, which I said are the allergic or the hyperreactive, they have to look at the non-synthetic sanitary towels, which are the cotton ones, which are now you get organic ones, which are made from fibers which are non-reactive. So they have to look at those sort of sanitary napkins. We have actually done patch testing in people and shown them that they are allergic to the liner of their sanitary napkins. But again, I repeat, these are only a small percentage of women who are genetically hyperreactive, who get allergic colds, they wake up in the morning sneezing, they have had eczemas in the past, their skin reacts to mosquito bites, to tight clothing, to synthetics. Those are the ones who have to be careful. How often do you change your sanitary napkin? It depends on how heavy your menstrual bleeding is. So if you have very, very heavy menstrual bleeding, and now with these ever dry ones which hold a lot, I think 3 pads a day seem to be fine for the ones who don't change 2 pads. So there is no sort of a ballpark figure that you need 3 per day or 2 per day. It's almost like if you ask me, Doctor, how often should I shampoo what is the rule for shampooing hair? There's no fixed rule. It varies with each person depending on their greasiness, their lifestyle, are they doing exercise? So same way, how many pads you require depends on how heavily do you bleed. Then you change it. Once you know that it's soaked and it's actually overflowing, you will need to change it because, again, as I told you, the more wet the skin remains, the more vulnerable it will be to damage, irritation, infections.
Okay. We'll take last few questions. One is, does having vulva cancer affect my sexual life?
So, why we have this program today is to detect early the vulvar cancers. Why is it important to detect vulvar cancers early? Because if you detect very early vulvar cancers where they have just remained in the skin level and not gone deeper, you can treat them. Some can be actually treated with ointments or just a little small local excision that will not really affect your sexuality or your sexual intimate life. But if you have waited and your vulvar cancer has now invaded, where you have your lymph nodes or larger areas are involved, then they have to do partial vulvectomies, complete vulvectomies, sometimes even the bladder part is removed, the rectal part is removed, then definitely it is going to affect your sexual life. That's why prevention is always a rule. Early cancers will not interfere with your sexual life if they are caught early and you don't require major surgery. But delayed cancers definitely it will affect you.
Next question is, how can we reduce the risk of vulva cancer in our daughters?
I think this is, I have already mentioned in the past, but for everyone who has females, young females, growing females in the thing, please discourage smoking, discourage multiple sexual partners, discourage very early sexual activity, always encourage using protection during sexual activity, teach them proper habits in cleansing, uh, how to cleanse and keep that area dry. Also encourage, show your daughters, or you examine your young daughters, the ones who are babies. When I say babies, I mean 7, 8, 9. Explain to them why you're encouraging, examining them. Don't scare them. And of course, vulvar cancers, HPV vaccine, and always be open with your daughters. Talk about the area, talk about sexual activity, talk about things which there should be no taboo. When I started the vulva clinic, I was amazed at how everyone said, "Oh my God, you're using the word vulva." I said, "It is a normal anatomical term. So don't be so uptight with words and terms. Be very easy with your children. Talk about sexuality. Talk about how to keep the area clean. Talk about promiscuity. Talk about smoking. I mean, kids are so intelligent. Rather than they get their advice on the net and from Google, it's better if they come from educated parents and informed parents.
Okay. Doctor, last question for the day. Suffering from itching, but how do I know it's this itching requires an expert for cancer?
If your itching goes on for weeks and weeks and weeks, or if you see your vulva and you see that there are now some unusual things happening to your vulva, for instance, there are some missing parts, there are some white patches, there are some black patches, there are some growths, there are some ulcers, you're having some unusual bleeding, then that is a time you have to consult us to examine you for early detection.
Okay. I guess doctor, that's it for today. Thank you so much for giving such an informational talk. And whoever who is having some doubt or you want to take appointment with Dr. Minina Madnani, you may contact on 022 6766 8181, or you can visit on our website www.hindujahospital.com. Thank you so much, doctor.
I would also give you my email. If you'll have any questions, I will be willing to answer your emails. My email is my name, ninamadnani@gmail.com. NINAMADNANI @gmail.com. There are a lot of, I know in these talks, there are a lot of people who are very shy, who have questions but are not willing to ask in a public forum. I am very willing to to answer your questions on email, and I see patients of vulvar disease on my OPD days, even if I don't have an appointment, because for me, vulvar disease is a priority, and women in India have neglected themselves, and we all have to work for the betterment of women. Thank you so much for joining in to listen, and I hope you have picked up some useful points.
Thank
Thank you,
you.
Hinduja Hospital, for giving me the opportunity. Thank you, Sonam, for organizing this and the
Thank
market.
you so much, doctor. Yeah.